at strategies to use when interacting with individuals living with dementia. So to start, I just want you to think about if these statements are true or false as you look at them. Do you think that Alzheimer's disease is part of normal aging? Do you think persons under the age of 65 cannot get Alzheimer's? And do you think that most people who are living with this disease are residing or living in care facilities, or are they living at home? So if you look at these, I'm hoping that you immediately are saying, oh, those are all myths. They're actually all false. So if you picked false for all three of them, you would be correct. So what we find is that we are continuing to help educate and dispel some of the myths that still surround Alzheimer's disease. So let's look a little bit more about what we know about Alzheimer's. Alzheimer's is really a global crisis, and you're probably hearing more and more in the news about this disease. And maybe you're even impacted in your personal lives and have a loved one or know of a friend or family member who has this disease. We know that currently there are 6.7 million people in the US living with Alzheimer's disease. And this actually, unfortunately, continues to go up as the number was 6.5 last year. Now, this information comes from the Alzheimer's Disease Facts and Figures Report, which is an annual report. So what does this mean? Well, right now we don't have a cure for this disease, and we'll talk a little bit more about that. So if the numbers continue, if we don't find a cure, by 2050, you can see what the number is likely to rise to, which is almost double the amount of people. So given these numbers, you are likely to have more calls, you're likely to more interact with more people who have this disease. And as we talked about with the true and false questions, it's important to remember and think about that about 70% of people with dementia are living in the community. And these individuals are cared for by family and friends and professional caregivers. So as the population ages, we're going to have more people with dementia who rely on community support to help keep them safe. Those who serve as caregivers are likely to become important partners with first responders in helping to meet this challenge. So nationally, if we look at statistics nationally, here's what we know. 1 in 3 seniors dies with Alzheimer's or another dementia. So we're going to talk a little later about risk factors, and you're going to see why that's the case in terms of that higher percentage. I wanted to point out and show you on the slide because I think it's interesting. When you look at the decrease in deaths from heart disease, which have gone down significantly from 2020 to 2019, look what's happened with deaths from Alzheimer's. They've increased by 145%. And again, a big part of that is we don't have a cure for this disease. So it's a fatal disease at this point. And we really refer to it as progressive brain disease. And we're going to talk a little bit more about that. We know that there are worldwide an estimated 55 million people are currently living with dementia. And because this is a disease that not only affects the person, it affects the caregiver and others who are helping to support that person, we know that we currently have more than 11 million Americans providing unpaid care for individuals with dementia, Alzheimer's or another dementia. So that's really important. And that has an impact on the family and the caregiver. Sometimes that means that family members are having to going late into work, or having to quit altogether because they're really trying to manage all the caregiver demands with their daily life, and it gets really complicated. So as I talked earlier about comparing Alzheimer's and dementia, I think this is a good slide to illustrate the difference in dementia and Alzheimer's. So often you probably will hear these terms used interchangeably. So they are related, but they're different. So as you can see on the left, dementia is really a general term for a loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. And on the right, you see Alzheimer's listed first, and that's because it's the most common cause of irreversible dementia. So when you think about when someone says, I have dementia, we really need to ask a little bit more, because what does that mean? Dementia is not a single disease. It's an overall term, like heart disease, that covers a wide range of specific medical conditions, including Alzheimer's. So disorders that are grouped under the term dementia are caused by abnormal brain changes that impact the ability to think, the cognitive abilities, and impact daily life and daily life activities. They also affect a person's behavior, feelings, and relationships. So Alzheimer's really, again, is a type of brain disease, just as coronary artery disease is a type of heart disease. Now, Alzheimer's does account for the largest percentage of dementias. So that's an important thing to kind of keep in mind. It accounts for 60 to 80% of the cases. But you can see listed here, there are other dementias as well. So wanted to just point out the other ones that you may be familiar with. Maybe you've heard of them. Vascular dementia, which is really caused by blood vessel blockage in the brain, is the second most common. But those who experience the brain changes of multiple types of dementia have what's called mixed dementia. And it's not uncommon for people to have more than one type of irreversible dementia. I will also say that it's important to really, if people are having problems and they think they may have the warning signs of Alzheimer's, that they need to get checked out, because there are many other conditions that can cause symptoms of dementia, such as, and these things can be reversible, such as thyroid problems, vitamin deficiencies, malnutrition, dehydration. All of those things may cause the symptoms, but they can be reversed. So it's really important if someone's experiencing these changes, not to ignore them, but to see a doctor. So, Alzheimer's disease is not something that comes on overnight. It usually starts out very slowly and gradually gets worse. So that's an important thing to keep in mind. As I said, this is not a disease that only impacts the person living with dementia. It impacts the family, because oftentimes they're providing a large amount of the caregiving. So adult children and spouses often serve as those primary caregivers. And what's often hard for families is having to accept changes in their roles and responsibilities. They're now having to take care of and provide maybe physical care for a spouse, and the roles really change. So it's a hard disease in terms of how it can impact the family. The demands of caregiving can limit a caregiver's ability to take care of themselves, and we certainly see this here at the association. People will put off their appointments. They don't think they have time because of the demands of caregiving for this individual. Caregivers for people with Alzheimer's and related dementias are at greater risk for anxiety, depression, and poor quality of life than caregivers of other conditions. And then, as you can see, the lifetime cost of care is more than twice the amount incurred by individuals without Alzheimer's. So I like to share this information because people often ask, how is this impacting individuals living in the state of South Dakota? Well, we know that there are 18,000 South Dakotans over the age of 65 who report having Alzheimer's. Now, this does not account for all the dementias we looked at, so that number would be even higher. I hope what you're seeing immediately is how this is impacting the caregivers. And again, I said often they will put off caring for themselves in order to take care of someone else. And so they're experiencing chronic health conditions, depression, and poor physical health. So when I talk to families, when we meet with families, we're really encouraging them to take care of themselves, because what is that individual living with dementia going to do if something happens to them? So again, using that analogy of, putting your mask on first before you put the mask of someone else on. In an airline, that's an important analogy because it certainly relates to caregiving. If you don't take care of yourself, you're not going to be effective in caring for someone else. So let's talk a little bit about what is Alzheimer's. We've talked some about it, but again, if you can think about progressive brain disease that causes problems with memory, thinking, and behavior. So a lot of times people associate it with memory and they think about short-term memory loss, but they're not also thinking about behavior, emotions, and certainly the symptoms can grow severe throughout the disease process, and it impacts their ability to do daily life functions that we all take for granted. So again, it is not a normal part of aging. And that's, again, a myth that we continue to help educate and share. And I'm hoping you can share that with others as well. So let's look a little bit. I like this next slide here because it gives us a visual of what is happening. We can't see what's happening in the brain. And I think it's important to realize what happens with Alzheimer's. So Alzheimer's, as I've said many times, is a brain disease. And the brain is our most complex organ. It's really powerful, and despite weighing only 3 pounds. So with this picture, it really depicts how Alzheimer's disease really causes that nerve cell death and tissue loss throughout the brain. So over time, we actually see the brain shrinking, and therefore that's why people are unable to complete tasks, care for themselves, and have many of the challenges that we'll discuss throughout today. So as we think about, this question comes up frequently, who is at risk? Am I at risk? What do I need to be thinking about? What do I need to be doing? Everyone with a brain is at risk of developing Alzheimer's disease. However, there are a few known factors that increase a person's risk of developing this disease. So you can see here on the left, I have about 5 bullet points that are kind of risk factors that put you at a greater risk. Think about, what do you think is the greatest risk factor? Take a moment and think about that. If you guessed age, you were correct. So all of these are risk factors, but age is the greatest risk factor for this disease. So most people who develop the disease are over the age of 65. However, we know that we have over 250,000 people that are living with this disease under the age of 65. And these individuals have what we call younger onset dementia, or early onset dementia. In terms of family history, that's another strong risk factor. So those individuals who have a parent, a brother or sister with Alzheimer's are more likely, not definitely, but more likely to develop this disease. We know that heredity plays a factor, and that there are actually 2 categories of genes that influence whether a person develops this disease, what we call risk genes and deterministic genes. I'll tell you a little bit more about those. And then certainly head injury. There's a link between head injury and future risk of dementia. So what are things that all of us can be doing and should be doing to protect our brain? Simple things like making sure we're wearing our seatbelt, we're wearing a helmet if we're doing activities where we could fall and injure our head. It could be things like fall proofing our homes. And certainly when you think about older adults, that's an important thing that we can all do. We also know that there's a strong heart to head connection. So some of the strongest evidence links brain health to heart health. So those things that are good to do for your heart are also good to do for your brain. So that's an important thing for us to remember and keep in mind. So this slide also talks about what we've just shared, that age is the greatest known risk factor, and an individual's risk for developing the disease increases at age 65. So you can see after age 65, the risk doubles every 5 years. And we know that 34% of people aged 85 and older have Alzheimer's. Gives you a little bit more information about family history here. We know, again, people that have a sibling or a parent with the disease, that increases their risk. I know in my own family, my grandmother had this disease, and she was the youngest of 8. And she did have a couple of siblings that had the disease, and then other siblings did not get the disease. So it's not a guarantee, but it puts you at greater likelihood. And then those genes that we talked about. So risk genes increase the chance of developing a disease, but they don't guarantee it's going to happen. However, deterministic genes do cause the disease. So that means that anyone who inherits a deterministic gene will develop a disorder. So rare deterministic genes cause Alzheimer's in a few hundred extended families worldwide. So this is more rare, but it can occur. So I also like to show this because sometimes this is surprising to individuals about who are individuals who what populations might have a higher risk. So studies show that Black Americans are twice as likely as white Americans to develop Alzheimer's, and Hispanic Americans are 1.5 times more likely. So why is this the case? Well, unfortunately, in these population groups, they may be less likely to pursue a diagnosis, receive support, or participate in a clinical trial. But if we look at what is the reason for these discs, researchers believe that 2 groups may also put them at a greater risk for developing Alzheimer's. We also know that Alzheimer's has a greater impact on women. So in the United States, more than 11 million women are Alzheimer's or caring for someone with it. So they're looking at real reasons for why women have a. So wanted to take a moment here because often get questions about what are signs, possible signs that a person may have Alzheimer's or a related dementia. So because Alzheimer's and dementia have such a profound effect on individuals, families, and our communities, all of us really need to be equipped to know how to recognize possible signs. So these are 10 key warning signs and symptoms, which can be subtle. They can be, usually the person doesn't identify this first, it's more family and friends. So it's possible for individuals to experience one or more of these signs in varying degrees, and it's not necessary to experience every sign in order to raise concerns. So I wanted to just give you kind of examples of each of these and then compare them to normal aging because of Alzheimer's daily life. So we know that with Alzheimer's disease, one of the things we see is that short-term memory loss tends to be the thing that's most affected. And so what's an example of this? Forgetting recently learned information is really a sign if someone is starting to do that. Possible warning sign. If you get an appointment, and maybe so one of the things you're going to hear me say a lot with these warning signs is we remember it later. So we might get distracted, we might get interrupted, we might be stressed, but we'll remember something later. Somebody who has Alzheimer's will not remember it later. So that's a key thing to kind of keep in mind. The challenges in planning or solving problems. So maybe somebody who was a good cook all their lives is a recipe. That would be an example. And wanted to share that. Maybe making an occasional error if you're balancing your checkbook. All of us make errors from time to time, but things that are familiar that we're good at, if the person starts to have problems with those, that can be a potential warning sign. May have difficulty completing familiar tasks, and the key word there is familiar. So if we hear stories in our support groups from family at a familiar location, so trouble driving to a familiar location. Maybe it's remembering rules to a game. Something that is normal aging might be, I don't know how to use a new piece of technology. Maybe I bought a new appliance and it's different, or I'm having trouble doing something on my remote that's a new technology. So that's where it's different. We certainly see confusion with seasons and the passage of confused about the day if we're all a little bit about, now, wait a minute, what day is it? And you remember, oh yeah, it's Thursday, but I've been off work all week. And so you had to really think about what day it was. So we can figure it out later. The person that's struggling who might have this disease cannot do that. Trouble understanding visual images and spatial relationships is another possible warning sign. So this one, sometimes people are not as familiar with. They don't understand that vision problems can be part of this disease as well. And that can affect things like balance, problems judging distance and determining color or color contrast. Normal aging would be having trouble with your vision, such as having cataracts. That's a normal aging, but not having vision problems that affect things like your balance or judging distance. We see that people have new problems with words and speaking or writing. So people might be continuously repeating themselves, continuously having trouble finding the right word. It is normal aging, though, for all of us to occasionally, if you occasionally do that, that's normal, but continuously doing it might be a possible warning sign. And then the seventh one, I think a lot of people have heard of this and they think, oh my gosh, I misplace things all the time. Well, if that is your normal, it's not a good comparison. And when we talk about misplacing things, we're talking about things ending up in very locations. Finding a pair of shoes in the refrigerator. We had somebody talk about at a support group in the washing machine. So those are places, and people with Alzheimer's dementia lose the ability to retrace their steps. So you and I might get distracted and put something in a place we don't normally put it because we got distracted. But then when we're able to retrace our steps and say, oh, that's right, the phone rang, I took that call, and I put something in a different place. I need to go back in that room, and there it is. So that ability to retrace steps, again, is a key phrase in there as well. We know that people have decreased or poor judgment, might make a bad decision from time to change, but we delayed doing it because we had something going on. I'm talking about making bad decisions, maybe when you're thinking about money. So maybe paying bills over and over again, forgetting to pay bills. Those are more examples of what I'm talking about there. All of us might, from time to time, not attend social activity hours because maybe we choose not to. They are really losing interest in things that were, kind of favorite activities or things they really enjoyed doing. And they tend to withdraw because they don't want to not be able to do something that others in the group are easily able to do. So they don't want to look like they can't complete the steps or participate or continue the conversation, mood and personality. So an environment that's comfortable and familiar. So that's how that's a little different. So I wanted to share that with you because I think it's important, since family and friends are those who are often, or outsiders are often the ones picking up on those subtle warning signs. If you're seeing any of these signs happening more and more, it's really important that someone goes to the doctor and gets checked out, because it might be something reversible. But if we don't get it checked out, we don't know. So when we look at now, we've talked about symptoms. We've talked about now about the stages of Alzheimer's. You've probably heard that term. First and foremost, I want to say that no two individuals experience the symptoms and progressions of Alzheimer's in the same way. The symptoms do worsen over time for everyone because people progress through the stages at different rates as their abilities change. Now, I often get the question of how long does a person live after diagnosis? So a person with Alzheimer's can live 4 to 8 years after diagnosis, but what other factors or medical condition the disease? She was very medical conditions or disease processes. She did have a diagnosis of Alzheimer's, and so she lived about 10 years after diagnosis. So on this slide here, you can see 3 broad phases, and they're in different colors. And what I want to point out to you is the asymptomatic, that teal color, is I wanted you to know that there are changes in the brain long before a person begins to have symptoms or gets a diagnosis. So Alzheimer's memory problems or memory loss. So why is that important? Because there are things that all of us need to be doing throughout our lives to lower the risk of getting this disease. And we'll talk about what are those things that we can control that may help us not get this disease. There's not, again, we don't know what causes it, so I can't tell you if you do these exact things, you won't get it. But there are things that we know that we can do that are likely to help us. As the disease progresses, the person begins to experience those mild symptoms, but they can still perform, is in the orange in that phase. And you may or may not be familiar with the term MCI, which is mild cognitive impairment. So that means those hallmark changes in the brain, that amyloid buildup, are present. So what's interesting about MCI is it can develop for multiple reasons, and individuals living with MCI may go on to develop dementia due to Alzheimer's, which is in that purple section here. However, some people do not. So it's kind of interesting. So that MCI is sort of that first step. So in the purple there, you'll see the third phase. So people who do develop dementia due to Alzheimer's will experience more serious changes in memory, thinking, and behavior. So this phase is broken down, and you've probably heard these terms: early, middle, late, or mild, moderate, and severe. And really what that means is how much the disease is impacting the ability of the person to do their daily life activities. So as the disease progresses, things physical care and support. So that's what that means. So we think about Alzheimer's disease really on this continuum. So what do those symptoms look like, or what might you see in someone who's in that early to mid stage? Now, again, it's important to understand that really these stages are general, and because each person is different and unique, we can't, all people may exhibit symptoms that allow you to gain a full understanding of the progress. Alzheimer's progresses, the individual's behavior will change, as does the role of the caregiver. And these stages can help caregivers and others know what to expect and how to best respond. So here you can see what tends to happen from language trouble with coming up with the right word or name. Mild symptom stage, who responds to you by repeating back what you said. We may see individuals in this stage who are having challenges with things like driving, difficulty remembering where items are if we ask them for certain things to produce. They may not be able to find them. They may not know what we're talking about. So then in the middle or moderate, we're looking at their symptoms here. What I want to draw many of the behaviors that are associated with Alzheimer's. So you're going to start seeing people maybe be maybe more withdrawn, maybe more anxious. You might see agitation. You may see other things that you're familiar with: rummaging, sundowning, some of those things that are kind of common behaviors that are associated with this disease. So they are going to have more challenges with language at risk. They're going to have a higher risk for all of us to know, because we hear stories all the time about the person that has wandered away, and now we're trying to locate that person. In the severe or late stages of the disease, these individuals really require a lot of physical assistance and support They rely on and they rely on us to, and we'll talk about how to do that. Ages impact the person. Not surprisingly, people with Alzheimer's, it's estimated that 40% of people suffer also from depression. So it's really common in persons, especially in the early and middle stages of the disease. And identifying depression and Alzheimer's can be really challenging because when you look at these symptoms, there are a lot of the same symptoms. Depression is more of a mood disorder that's put ourselves in the shoes of somebody with Alzheimer's all their life. They've known how to do that they're good at. It's not surprising that we see depression go hand in hand. Certainly these symptoms, again, can apply to both depression and dementia. So it's really important that, you know, for us to utilize physicians and doctors to do really a thorough diagnostic assessment to understand, is it now. On a brighter note, we are really excited at the Alzheimer's Association because there's exciting progress in research. There's a lot of research happening, and it's creating promising new treatments for people living with the disease. And you may or may not have heard this, but we currently have 2 treatments that can change disease progression. So in the past, we've only had medication that we now have 2 medications. The next slide. There are 2 that removing beta amyloid, which is one of the hallmarks of Alzheimer's from the brain, reduces cognitive and functional decline in people living with early Alzheimer's. So I want to say that these 2 treatments actually slow the progression for a period of time, allowing the person more time. But these are only appropriate for people to determine whether it's appropriate. I think what this tells us is that it's really important that people get diagnosed early because they now have some options they have not had in the past. There's also a lot of worldwide effort underway to find better ways to treat the disease, delay its onset, and prevent it from developing. So, again, when thinking about any treatment, it's important to have a conversation with a healthcare professional to determine whether it's appropriate. So I think this next slide, maybe a new disease. When we think about this disease was first kind of discovered or described in 1906. That's a long time ago. And for many years, the only thing we had were medications that treated those cognitive symptoms. So from 96 to 2014, some of these are probably very familiar to you. Aricept, Exelon, Namenda. This is what we had. So we're excited new medications that target the amyloid that can really help individuals to potentially slow the progression and have a longer period of time. And that's really important because it allows people to make plans, do things that are important to them. It gives us more time. And I think that's really a gift. So again, these slow down the disease progression by targeting that underlying biology of the disease. So this is really important. I'm glad to be able to looking at as well, but that's what we have. So oftentimes I get questions about brain health. What can I do? What are those things that we can do? So let's talk a little bit about that. So in addition to those exciting advancements in treatment, there's more research every day about the importance of brain health to reduce the risk of Alzheimer's and other dementia. So we know there are things we can't control. I can't control the fact that I'm aging, right? And we know that age is the greatest risk factor. However, there are some other key healthy habits that might help us lower the risk. So things like making key lifestyle changes, including regular physical activity and exercise, staying socially engaged, maintaining good heart health. Again, remember what's good for the heart is good for the brain. And it's also important to think about it's never too late or too early to start doing some of these things. So that's an important point too. Some people think, well, it's too late for me. Nope, it's not too late. You can still start doing some of these to try to make a difference and lower your risk. So these are real, and I look at this list and I think, well, I do some of these things pretty good, and others I really need to work on. So we know that education is important in terms of continuing to challenge our brains and our minds. So staying cognitively engaged, really thinking about trying new things or something that's harder. I'll have people say to me, well, I do a crossword puzzle every day. Well, are you challenged? Are you doing harder ones each day for new things that really challenge us? Maybe you're going to try to learn a new language. That would certainly challenge me if I tried to do that. Getting moving, eating right, and maintaining that healthy weight. We know that regularly engaging in physical activity increases your heart rate. It increases that blood flow to the brain and body. So thinking about how can we build physical activity into your day. And I certainly need to do more in that area for myself. I know diet is important too. So healthy and really having a balanced diet is really good for the brain. So that means staying away from fat, saturated, fat and processed foods. We know those are not good for us, and really focusing more on vegetables, fruits, and lean proteins. So that's an ongoing work for me. And when I think about my diet and what I like to eat, certainly we know that a healthy weight is important for both heart and brain health as well. So increases the risk for cognitive decline. So again, what's good for the heart is good for the brain. We know the importance of controlling blood pressure and managing diabetes, because those two things both are connected to brain health. And we know that type 2 diabetes is a risk to brain health. So again, thinking about all of these things and how they're related are just things that we are asked, what are things I could be doing? We've already talked about the importance of protecting your head. Sleep. We all know the importance of sleep, right? Getting a good night's sleep and good quality sleep. So that's really important to brain health as well. So if you have a sleep-related problem like sleep apnea, for example, it's important that you get that checked out and talk to a doctor and see about, how can I minimize that so it's not affecting my sleep. And being smoked increases the risk of cognitive decline and possibly dementia. So again, quitting smoking could be maybe one thing that we do that helps our brain health. So I've talked about a lot of information here. We're going to now switch gears and talk about, so that's what you know about Alzheimer's and understanding Alzheimer's related dementia. So want to move, what's the best way we can do that? Very hard. I said some of those signs that people have initially are very subtle. Now, an individual that's living with dementia, though, may appear at times confused, disoriented. They may have an expression that really doesn't match the situation. So maybe they look confused or they have a flat or blank kind of expression. Um, or maybe an expression that's not appropriate all to the situation. We see that people, again, think back to those warning signs. And so I might not dress appropriate for the weather. Emotionally, the person can be a lot more fearful or anxious or agitated because they don't understand what they're supposed to do. When interacting with the individual, I think what's important to remember and kind of keep in mind is they may not know how much time has passed. They might not know what day it is. They might need you to tell them over and over again effective technique, and you may have to do that quite a few times. They often will provide inappropriate responses to the questions you ask. So dementia, certainly, because of those changes in the brain that occur with this disease, it's important to change how we respond when we have an incident occur follow, with a person with Alzheimer's or related to maybe unaware that things that they're doing. We hear of stories that are very unfortunate, walking along a busy road. They don't realize when they may need help. So that confusion that's part of the disease can really put them or others in danger. And so I think it's really important to understand that. And then it's important to think about how can I adjust my approach to help have a more positive Alzheimer's or dementia. And I think it's important, we talked about impaired judgment. So this could be things like within the household, turning the oven on, turning the stove on, and then forgetting to turn them off or keeping them on too long. So the judgment, that person's judgment or ability to do that may change throughout the disease. Sense of place and time, we've talked about that. And that could be as simple as even getting lost on one's own street, whether the person's driving or walking. Their behavior and personality changes and behavior changes with the person living with dementia. Physically, we talked about those vision issues that might cause the person to have trouble with balance. We know depth perception is impacted with this disease. So they may experience changes in vision, hearing, um, sensitivity. So this is just important things to keep in mind because I think they will make sense when you're interacting with someone, when you see these, because these are their deficits. The thing in driving is a huge topic. It's an issue that many caregivers are impacted by because their loved one will not give up and does not want to give up their loss of independence and the ability to drive. But what's so scary is we know that with dementia, it impairs insight, judgment, and it makes driving really no longer safe. So this is really important. And, as we look at how it can impact driving, this is not everything of people who confusing the pedals, and so they think they're stopping the car and they're instead accelerating and running into things. So again, all of these things are not surprising, but they're an important thing, because there may be people that we don't know have dementia or Alzheimer's who are out driving. And so we start seeing problems with some of these, we need to pay attention. Common situations, this is not going to be surprising to you that this group of individuals is very vulnerable to many forms of abuse. They may try to go home when they're already there, or they attempt to create a familiar routine, such as I need to get to work, or I need to go pick up the kids. They can accuse others of theft or make false accusations because they don't recognize people, even their own family members. And that's because of what happens with the disease process. They may think those individuals are intruders. They may, have behaviors in public that people view as inappropriate. And that could be something like disrobing. So, these are really hard as you think about the individual and you think about caregivers trying to support individuals. They may have extreme reactions to common events. They can misinterpret surroundings. So one thing is that people with Alzheimer's really have trouble differentiating what's happening on TV. So they think that that's actually happening in their real life. So that's often things like the news are not things that are effective for people to watch, because they can also often cause behaviors. And they may overreact to events that are going on that we don't even maybe pay that much attention of. So the doorbell or children playing really loud outside might be very distracting because they're not able to tune out those distractions. So let's talk now about what we can do when we're interacting and what are some good communication strategies. So we talked about difficulty with balance and gait, and that's because they may have apraxia, which is one of the hallmarks of Alzheimer's. In terms of communicating, when you're trying to communicate with someone with Alzheimer's or dementia, they may have been able to hear you, but they don't know what you're wanting them to do. So they may not be able to follow your instruction or what you're asking. One of the things that is hard for someone with Alzheimer's, but let's talk about communication, interact with people. It's important for you to know that they lose their ability to communicate through thoughts and their thoughts and feelings through words. So when we talked about that progression, mild, moderate, and severe, initially, the person might just have trouble finding the right word more frequently. But as they move through the disease, they're going to communicate less verbally and more non-verbally. So we're going to really have to pay attention to the individual and what is the communication they're sending us non-verbally when they can no longer use words. They lose the ability to understand. So it's not only about not being able to verbally communicate. I don't understand what you're asking of me. But I will say what does remain is that person's sense of self. So who they were, what was important to them remains. So that essence of the person, their sense of self. In terms of communication changes throughout the disease process, we've talked about some of these, but I wanted to describe a couple more to you, maybe in a little more depth. Describing familiar objects instead of calling them by name. So Maybe instead of calling, your watch, I'm wearing a watch, or if they don't know what this is, they might refer to it as a clock thing, or, by another descriptor, rather than being able to really name what a familiar object might be. They may easily lose train of thought, even within a conversation or something they're saying. You can see that organizing words logically becomes harder. And for those individuals who spoke another language growing up, it is not unusual for people to revert back to that native language, which means we have to know what key words mean in a language in order to communicate with someone. Or we might need to use pictures to communicate. We're going to have to be really creative there. And then in the later stages of the disease, there's less speaking with verbal words, and they rely on us to non-verbally communicate. So we could use gestures, we could use body language, facial expressions. Eye contact is going to become increasingly important. So what are those things we can do? We know what they can't do, but what can we always do? Well, I said the importance of identifying yourself. Because every time you approach someone, you could be viewed as a stranger. You might look familiar, they might not be able to call you by name, but if you introduce yourself and you call them by their first name, that will send the message that, hey, that person knows me, they call me by name. So they're more likely to work with you if you, again, identify yourself and address them by their first name, because that sends a message that you know me and I must know you. Sometimes slowing down is the fastest way to finish. So it's hard because we, again, move very quickly in our society. So slowing down, speaking clearly, moving more slowly, presenting one idea at a time or one question, and allowing time for that person to answer. So you want to give them at least minimally 15 to 30 seconds to respond. So you're going to have to wait. It's not that people can't respond, it's sometimes they need more time. It's better to ask questions that are like yes or no, or limited choices, rather than saying, giving them an open-ended question. Okay. So if you're wanting to know someone, you could phrase it with yes or no, or do you want this or this? That's the better strategy to use, because the person can have a couple of items that you could show them as well. That would be another way to communicate with limited choices. And then what we'll find throughout the disease process is we really have to watch the person's nonverbal communication. And then we often have to use the 5 senses. So if I can smell it, taste it, touch it, feel it, I'm likely to make a connection. So those things are really important as the disease progresses. I tell you, when you cannot understand the word times, because feeling, they're probably mad. If they look sad, they're probably sad. So respond to the feeling, because they're going to interact with you if you recognize how they're feeling. So sometimes all we have to do is, you look really upset, or you really sad. Person is more likely to respond back. All adults approaches, we're having to simplify them, but they shouldn't be childlike. They should be adults. How we approach people is really key, because they'll let you know if they feel like they're not being treated like an adult. So this is really important. The other thing is, I always ask people, because I've never met one yet, if you've ever won an argument I've yet to meet a person yet who's ever won an argument with someone with Alzheimer's. So it's better to think about doesn't really matter whether it's right or wrong. And the message we're sending the person when you're correcting or arguing, and we see this with families a lot, is that the person doesn't want to interact with you because they're not living in the same world or reality that you and I are. Okay. So that's what's really hard for people living with this disease. We know that Alzheimer's and other dementias can cause people to act in different and unpredictable ways. And that might be through different behaviors we've never seen before, like being aggressive or agitated, or stories. And they may misinterpret what they hear. So thinking about communication, and this is still really communication, because I think a lot of times when someone exhibits a behavior, it's a form of communication. So again, if you find yourself getting in a power struggle or arguing, you need to step back and say, wait a minute, this is not usually a good approach. It's better to join the person where they're at, as long as it's not hurting them or hurting someone else, really just to kind of happen with the disease process. That's what they're able, the people who are trying to bring them into, 2023 are going to really struggle because they don't have that ability. So, good qualities to, think about and use are being flexible, patient, and supportive. Responding to that emotion when you can't figure out the words. And thinking about how do we create a calm environment. People with Alzheimer's and dementia have a really hard time area where there's not a lot going on because they get very distracted. And if you're trying to talk to them, they can't follow you. So it's really hard. And I know that's not always easy to do, being in a calm environment, but calm, familiar, those things are going to help the person. Some simple things that we can do is acknowledge and validate how they're feeling. Show them that one of the easiest things is just listening. You don't have to always have the answer, but just listening and look at what is causing that person maybe to behave in a certain way. Is there too not familiar? All of a successful interaction, because this goes against our daily life and how we operate at home with our families and our work lives. But we really need to slow down because this group of individuals does not do well with being rushed. And we live in a very fast-paced society. Asking those simple questions, maybe with the yes/no option, and allowing significant respond. Avoiding this individual lacks the ability to rationalize. So again, joining where they're at is a much better approach. Maintaining eye contact or keeping eye contact. Sometimes the person doesn't even know you're talking to them. So really important to keep that eye contact. We talked about approaching from the front, was on one of the previous slides. And we do this so that you don't startle the person. And remember that peripheral and vision is affected, and depth perception. So when you think about, I don't even know you're there, so you're likely to startle me. Tell the person you're there to help and ask if you can help them, I think is important. Being creative and using a distraction or something they might like, or distracting them so that you can interact with them and have a successful experience. And then most of us like to laugh off something we do that might be, embarrassing or stressful. And so keeping a sense of with the person, we all like to be able to laugh. And, these individuals are doing the best they can with the disease they have. So supporting them is really important. Now, because this is complicated and cognitive impairment, we can't see what's happening in the brain. We can't see when someone's progressing necessarily. What will let you know about all of our programs and services are free at the Alzheimer's Association. So we have our South Dakota, all 66 counties. I tell people about and really want people to know is our 800 helpline number. This helpline is staffed 365 days a year, 24/7, with master's level clinicians who do nothing but take calls and provide support and information to everyone. So it might be a person who is living with dementia. Maybe they were recently diagnosed. It could be a caregiver, or family caregiver, anyone in the public. We have different businesses call and ask situation. So please know that this resource is available to you and anyone you know who's struggling, maybe with a particular situation or something new that's happening for someone living with Alzheimer's. Education, we provide a variety of community education programs on a variety of topics. And these are available on demand online, so people can come and take a course for free or in person. And it's really through this Alzheimer's Association and Community ARP Community Resource Finder. That is the location where you can find resources in different communities throughout the state. You can find out where community programs are happening, so that if you're wanting to learn more information, that's available. Then maybe some that are more specific when I think about first responders or law enforcement, things that may do with those. I think it's important to know for individuals with Alzheimer's or related dementia who wander or have a medical emergency. They provide 24-hour assistance no matter when or where the person is reported missing. So again, that's an important program. And then I wanted to specifically make sure you knew that we have an online course that you can take at your own time that work for you. It really is specific for first responders, and hear from other first responders about that might be related to abuse or neglect, shoplifting, wandering. So I just wanted to share that there are a variety of resources through the Alzheimer's Association to help support everyone who is interacting with people with dementia. So I know it's important with any program to allow time for people either to make a comment or ask a question. So Michaela, that C, I don't know if you've been able to monitor, will have questions. We certainly could take time for those.
We did have a couple questions that were in the registration that I did add to chat if you want to take a look at that.
Okay. Okay.
So and I can read them off too if that's.
Look at the chat. Are you able to tell them? Okay. Oh, sorry.
Oh, sorry.
Okay.
Oh, there you go. I wasn't sure if you were trying to do that.
Oh, perfect. Perfect. All right.
Yeah, I can read them too.
Okay. Okay. So, are trends changing in terms of age of diagnosis? Um, well, here's what I would say. Okay, so we know that age, if I'm understanding the question correctly, um, age is the greatest risk factor. So, um, I think people are now more likely to get a diagnosis earlier because we know that there are treatment options available for people in the early stages of the disease. So, unfortunately, we for a long time have seen a lot of hesitation because of stigma. We don't want others to know, families might not want others to know that they have this disease, so they may, not get an early diagnosis. They may try to handle it on their own. But I think now, because people are hearing about new treatments, they're hearing about options that exist, they are doing a better job of earlier diagnosis. So, again, you saw the numbers. So, again, we don't have a cure for this disease. So the number of people keeps increasing every year. So to that first question there. Okay, the next, helpful hints and pointers in identifying traits and how to approach. Okay, I hope that was, you found some of the things we talked about with those warning signs. Will help you to identify kind of traits or deficits that people might have. And then knowing those deficits, how do you approach that person? So again, when I think about communication, are you calling the person by name if you know their name? Are you telling them who you are and what you're there to do? And again, one step at a time, slowing down, smiling. There are things that all of us can do non-verbally that I have to really remember this. I have a bad habit of crossing my arms. And so for somebody who doesn't know me, and that could be a person with Alzheimer's who thinks I'm a stranger, they may be more, not want to approach me because I'm sending a nonverbal message that I'm not approachable. So simple things that all of us need to pay attention to. Are we smiling? Do we look approachable? Are we nodding? Are we acknowledging? I think all of those things are really, those nonverbal communication tips are going to help. Oh gosh, these are great questions. They're hard questions. How to determine if it is dementia or a medical emergency? Well, one thing I'll say, and I don't, again, you guys can, if I'm not answering your questions, if you have further questions or I'm not getting to what you're exactly asking for, please don't hesitate to elaborate. But what I'll say is Alzheimer's and dementia does not come on overnight. Okay. So Alzheimer's is very, very subtle. When we think back, and if you've had a loved one or family member, I know with my grandmother, we had to really think about, when did this really start? Because it was hard to pick up on. She could do what I called socially faking it pretty well, and some people can do that. So if you're having just chit chat, how are you doing? Oh, I'm doing fine. And how's your family? Oh, they're doing great. It's when you go to ask more specific questions that you start to see the deficits in people with Alzheimer's and related dementia. Now, remember though, all of us could have a reversible type of dementia. So if you wake up tomorrow and you have increased confusion, memory loss, those symptoms, and it happens very quickly, we need to, again, it would be good to get checked out, because is that happening because maybe you're taking a new medication and it has those side effects? Is it interacting with another medication? Do you have a thyroid issue? Are you malnourished or dehydrated? Maybe you're not sleeping well, and it's lack of sleep that's caused impaired judgment. So, the difference is there. Again, somebody with Alzheimer's or, an Alzheimer's type dementia, it's really hard to pick up on initially in the early stages. So, I would say for that question, is it appropriate to agree with a patient's delusion? I would say, if somebody with Alzheimer's, correcting them usually doesn't work well. So if the delusion is not causing them harm or someone else harm, I would tell you to go along with it. If it's not hurting them, it's not hurting someone else, and it's not causing them anxiety or frustration. I can think about, I worked in long-term care before I came to the Alzheimer's Association and worked there for many years. We would have people who thought there were people hiding under the bed. Well, I certainly didn't argue with them. I would try to ask them, how many do you see? Well, there's several, people I'm seeing. Okay. And so maybe I would do something that I tried to be creative in the moment and say, okay, I need to get everybody to get out of this room. It's time to leave. So-and-so doesn't want you here anymore. And then I'd hesitate and I'd go back to the person and I'd say, are they still there? I don't know if they're there, right? We can't see what their reality, we often can't see or know. So again, unless it's causing a problem for them or someone else, in terms of safety, or it's even more frustrating, I would say go along with it because you don't want to make the situation worse. Are there other questions? These are great questions. Michaela, did I miss anything?
Nope, I think you got it. We did put the handout that you sent me in the chat as well.
Okay.
So that's there. Thank you for your
Yeah. If anybody wants additional information, I certainly would be happy to, we have topic sheets on a variety of topics. We have brochures. We have lots of information. I didn't talk about it, but on our website, alz.org, you can find a wealth of information on a variety of topics. But certainly know if I can be of any assistance to you, please know that you can reach out. And again, that helpline, because what we know is that when we're working with people with Alzheimer's and dementia, a lot of times the situations that occur don't happen between the hours of 9 to 5, right? Or Monday through Friday. And so that's why I think that resource is invaluable to a lot of people, is that you can feel like there's always somebody that could help walk you through the situation and provide resources. So I just really appreciate the work that you do. It's hard work and we need you. And I'm sure that you encounter a lot of individuals with Alzheimer's and related dementia, and it's not easy because I'm sure the situations you're in, you have to sometimes maybe move quickly and act fast. And that's, can be really challenging, I know, with people. But I think supporting the individual is really important, telling them you're there to help, reassuring them that everything's going to be okay and I'll be with you. I mean, simple things like that really go a long way. You don't have to have these magical, really difficult interventions. It's providing that support and reassurance when someone's trying to figure out, how do I make sense of a world that doesn't make sense? So thank you.
Thank you so much. Like I put in the chat, if you could please fill out the survey, that would be greatly appreciated. and everyone should be getting their continuing ed in the next couple of days. So thank you very much, and thank you, Michelle. We appreciate you taking time this evening to speak on this.
You're very welcome. Thank you. Have a
Thank
good
you.
week and a good holiday, Thanksgiving holiday.
Yep, you too.
Okay,
Thanks.
bye-bye.
Bye.